So I used this harp to place this harp on the patient and let her feel the Buddhist chant that I had played for her. So something like this, yeah. My name is Joanne. I journey with patients in their final days, and nursing is my lifelong purpose. For palliative care, I think it's an area that's close to one of my aunt's heart. She used to teach a module in the area of death and dying at the university. She's one of the few people who has had a huge impact in my life. That's why I decided to go into palliative care in nursing as my first job in healthcare. When I first started my job as a hospice nurse in 2017, usually I will spend my time researching on topics related to death and dying, hospice care and palliative care, and basically anything related to end-of-life care. So one of the terms that had initially popped up was the term death doula. I was curious about this term initially, so I decided to read more and research more into this topic, and I decided to ask myself, where can I go for training? Thanks to Google, I managed to find out where and how I could sign up for a death doula training. The nearest place I managed to discover was this training that's conducted in Melbourne. So that was in year 2019. I got my registration done online and booked my flight and just went over there for the 5-day training. That was just a very eye-opening experience for me. And if I could, I wish I could relive this experience all over again. I discovered there's this area under end-of-life care whereby the harp is used at the bedside, where the musician will play prescribed music. There's a special term for this area of care, and it's called music thanatology, and it's something that I hope to focus more on when I have the time to do so. Yeah. Other than my role as a hospice nurse, I also volunteer as a death doula at the Institute of Mental Health. For patients who are under this No One Dies Alone program, a lot of them, they do not have any next of kin. So my role is mainly to play a role of a friend or fill in the role of a family member for them, visit them as often as I could. Let's say if this particular patient likes carrot cake, when I visit them, I'll buy them carrot cake. For some of the patients, I also bring them on a garden walk. Usually this is one of the best times to talk to them about their lives. Yeah, get to know them a bit better. I had one patient who really enjoyed listening to Christian music, so I would bring along my harp and play Christian music for her. These are the simple and yet important things which I think the patients appreciate when they're already nearing the end of their lives. Why I decided to carry on with my studies in the Bachelor of Science in Nursing Practice at NUS. But initially I just thought of stopping at the level of Diploma in Nursing. But I feel like if I can learn more, why not do so? And if there's opportunity to do so, why not go ahead with it as well? And also add on to my knowledge and skills. And that's in order to provide better care for whoever I eventually get to meet in future. Since I'm in the area of end-of-life care, it's been an emotional journey at most times, but very meaningful because I've learned a lot of life lessons from all of them whom I've had the chance to journey with. I've encountered many patients who have had many regrets just when they're about to breathe their last, because they still have loved ones whom they have lost contact with or not spoken to for the past many years because of things that have been said and done. So at the end of the day, what's most important is just keep life simple, and whatever blessings that come along, just be thankful for them.